The Infectious Diseases Act, or IDA, is the principal legislation for the prevention and control of infectious diseases. As it stands now, the IDA envisages only two worlds of public health, peacetime or public health emergency, with no gradations in between. COVID-19 taught us that in a prolonged pandemic, we can go through different phases. So the IDA must be amended to deal with a wider range of scenarios. We envisage 4 public health situational tiers under the amended IDA. First tier is baseline, which is a peacetime state. Second tier, outbreak management, where a pathogen of concern is detected and measures may need to be implemented urgently to manage disease outbreaks. And these include contact tracing and quarantine, testing, border controls, and masking. And these will buy us time to understand the characteristics of the pathogens, the 6 characteristics I mentioned. Third tier is public health threat, where more stringent, widespread, and longer-term control measures and restrictions are needed. These include various SMMs and restrictions up to and including a circuit breaker-like imposition. And then finally, the highest tier, public health emergency, where very stringent measures such as curfews or requisition of public health assets and manpower may be effected. When these changes come into effect, we can also use these 4 situational tiers to replace the current Dorscon color coding. I think it is more intuitive to tell the public that there is an outbreak, a threat, or an emergency, as opposed to colors. And the law spells out what measures could take place under each situational state.